Today we're going to talk about lines. Now, what do I mean by lines? Smile lines and lines around the mouth. This is one of those things that I want to concentrate on because I think it's overhyped. It's something that almost everyone fills with Restylane. Everyone thinks is going to get away by just lifting your face up with what I call the two-finger rule. So there's a lot of misconceptions and mistakes about thinking about what can fix lines. Do lines need to be fixed? Who should I fix lines for, etc. So let's take a step back and figure out what are these lines? What's going on here? Well, the line is just really the connection here where the muscles insert and the skin inserts into this area. So over time as you age, it can get a little bit deeper. But the problem is most people look at those lines as the sign of aging, and it really oftentimes is not. And even if there is some aging with that line, does it make you look worse? Now that may be a given. You may go, come on, doc, it's so obvious. My line is deeper, I look worse. But oftentimes what's the problem is that hollowness around the eyes and cheeks is the problem. It's not the line itself. And how do I make that judgment? Well, this is where artistry comes about, because when I look at your face, I'll make a judgment. Will it improve you if I fix a line, or will it not? And that may sound like a given, and it's absolutely not. In about only 1 out of 10 patients will I fill that line. But in the mind of the patient coming to me, 9 out of 10 or 10 out of 10 think that line needs to be filled, and it's a mistake. It's a waste of money. And the thing, as you probably heard in my other vlogs, I will not waste your money. So filling those lines can be important, but here's the interesting thing. Oftentimes it's only important if I work with it, if I do other areas, because these areas are very important, and then that's like the bonus. So I sort of scale it down by prioritizing. Remember in my other video about making decisions for you, I prioritize which are important areas, and then I scale down. So how do I even prioritize the lines in terms of other things? Even if the lines are important, in general, where do they fall? And let me help you figure this out. As I mentioned in another video, the anterior cheeks oftentimes can be number one. Not all the times if you're really hollow around the eyes or if you're very heavy. If you're very heavy, the jawline tends to be the most important because it'll make you look lighter, it'll make you look less heavy. If you're very gaunt, the anterior cheeks are number one. And then number two is maybe the lower eyelids. And then if you get that really bitter lines where it just sags down like this, that would come probably pretty close next. And this is the last. Only time that I don't like this line is what I call a stiletto line. My nurse, Diane, I hate to say this, had it and now doesn't have it anymore. It's almost like this gouge that goes around. That makes someone look older. So it's a certain style of a fold that makes someone look older. And that's the fold that I will address. It's not just a knee-jerk reaction to go fill a line. I think that's a waste of money. And it's a waste of time. And it's a waste of putting in that precious Restylane or filler in the wrong place. So that's important that you make a decision and you work with me to show you using my before and afters which is the most important area. So if we had to prioritize between the two lines, in summary, this oftentimes is more important than this. Let's finish one more thing about lines, because the small lines around the mouth is what, Linda, who's filming this, she's nodding her head. Every female, in fact, I even just say, Linda, what's the answer? And she goes and tells the patients, oh yeah, I know the lines around the mouth. Because every female, I don't mean 9 out of 10, almost 10 out of 10 are focused around the lines around the mouth, and no one else can see it. And Linda was in one day, and we had a patient there, and the patient says, of course, Dr. Lam, you're going to fill these lines around my mouth, right? And I go, what lines? And I said, Linda, do you see her lines? And Linda goes, no, I don't see any lines there. And then I said, Linda, do you see her own lines? She goes, yes. And I asked the patient, do you see Linda's lines? And she goes, no, Linda has no lines. Because we have a misperception of this. I had a mother and daughter in consultation today, and the daughter brought up lines. I told the mom, I bet you saw the lines, your own lines, but you can't see your daughter's. The daughter can't see the mom's. This is why we're too close to magnification. So anyways, those lines tend not to be that important. And sometimes if it's just a pursing activity, then a little Botox will rest that area, even though it could cause some speech issues for a short time. Sometimes if people purse a lot, it will relax those lines. So I'm not really trying to focus on those lines, but I just thought I'll throw that in case there's all these different lines. But we're talking about lines around the mouth. What will not work? Okay, you know that I do fat grafting to restore upper mid-face and jaw lines, and you know I do facelifts to restore neck and jaw lines. Interestingly enough, you think, well, come on, down the street I had some fat grafting, it didn't work in the lines. Because fat is not good for what, Linda? Okay. That's right, lips and lines. Lips and lines, she knows that, and she says it every single day. Those are the two areas that do not work. So these areas fail. Now, do I put fat in the lines? Yeah, but it really doesn't do too much. Not the point of being impressive. It's more for contour. So that's a mistaken area that everyone tends to put fat into to think that's going to work, and it doesn't. Facelifts. There was a study that came out many years ago initially saying, oh, these lines get better with a facelift, and then the same famous doctor who wrote this about it 2 years later said, no, it really doesn't work. So he was at least honest enough to say long-term effects of lines with a lift do not work. In fact, I did a study when I used to do cheek lifts, and I don't do them anymore. Now I do volume restoration. But when I did cheek lifts, we did 3 blinded observers to look whether a cheek lift would even fix this. And for a short time it did, but it doesn't hold. So the bottom line is surgery, it is not a surgical treatment. I use fillers to fix them. And again, remember when it's important. Let's finish with one more thing, which is what do I use to fill the lines with? I don't believe in solid implants. I really talk about that in my lip thing, and I believe the same here. The problem with solid implants, these are complicated terrains. You can't just put a solid piece of implant in there, plus you can feel it. Linda, who's filming this, everyone, all my assistants who come in here and stand with me, I said, feel this face. Remember, this is a hypermobile zone. When you smile and when you kiss someone, when you go feel your face, you don't want to be reminded you got something in there. That's why I don't like Gore-Tex, even though I like it for the bridge of the nose and Asians and some Hispanics as well, but a few Caucasians. But it's great for the bridge, the Gore-Tex. It is not great for highly mobile zones. And now with all this big thing, with all these brands out there, Varifil, Surgisys, all these things that are silicone or Gore-Tex laden things around the mouth, I will not do it right now. Maybe I'll change my mind in a few years. Right now, it's something that I really, really don't like. So I use Restylane for short-acting results, Radius for longer-acting results, and I still use silicone, which is, it's off-label, which means perfectly legal through consultation with you, and I do that for deeper folds, especially around the mouth area here, not for the fine lines, but for the deeper folds. So hopefully that was a good video of just thinking about who would benefit from lines, and oftentimes, as I said, it's many fewer people than you may think, and also prioritizing those lines, and finally, what treatments would be beneficial for lines. Thank you.